So my condition is general anxiety disorder, also known as GAD. Some background information on it is it's one of the most common among the four primary anxiety disorders, and often is confused with them. Those are panic disorders because panic attacks and anxiety attacks can be seen as similar. There's also social anxiety, phobias such as fear of fires, fear of spiders, and then there's also PTSD, post-traumatic stress disorder, and OCD, obsessive compulsive disorder. This disorder is commonly seen in children and young adults. Anxiety is also primarily focused on the neurotransmitter of called gamma aminobutyric acid, GABA. It's regulated specifically by that neurotransmitter, and there are medications in order to help it. Some risk factors are that females are predominantly shown to have a higher prevalence in getting it more than males. Uh, as for genetics, the 5-hydroxytryptamine transporter, or the serotonin transporter, is seen usually through blood work. There's also the personality traits like sociability and talkative, and the family dynamics such as parents who've been divorced or living in a foster home, and environments such as school. Some signs of having an anxiety attack, as I mentioned, panic attacks and anxiety attacks are seen as similar. Primary ones that are shown to be more towards anxiety is the fact of them losing the feeling of them losing control and the muscle tensions. This is very good to recognize the difference between the two so that you can see what your patient is actually going through. Uh, there's obviously other signs and symptoms that make anxiety shown a lot more, is the fatigue, the difficulty concentrating, uh, and the eating habits, which is commonly associated with eating disorders. So in order to diagnose it, you need to use scales. So we have the GAD-7, which is the golden standard, a Beck Anxiety Inventory, and also Hamilton Anxiety scale that are shown or asked a series of questions and then basically scored at the end to determine whether or not how bad your severity is of anxiety. So the GAD-7 asks a series of 7 questions. They're based off of 2 weeks on how they've been feeling and how these problems have been bothering them. And then those are scored at the end, and then they are asked the final question of how difficult they made them to do these certain tasks after these problems have been shown. Lastly is prevention and management, or second to lastly is prevention and management. The relaxation techniques and management skills, I will further show you some of those. Education on the disorder, obviously, just making sure that they know what GADS is and what is going to be exposing them. So they are also going to be provoked into situations that place stressful issues onto them that they can work through. So that's like the problem-solving strategies in these management skills, or establishing their life goals and getting active in activities and getting a better emotional well-being. So as an athletic trainer, we should all know what grounding is, or be educated on what it is to help uh, these athletes in not letting their head get too lost or out of control of their surroundings. So we want to be able to have them list 5 things that they can see, 4 things that they can touch, and 3 things that they can hear, 2 things they can smell, and 1 emotion that they feel. So then we lead into these treatments like the cognitive behavioral therapy. Therapy is always seen with anxiety patients to release those stresses that they have. Pharmacological, we have the medications like benzodiazepine, which targets that specific neurotransmitter in helping regulate it. We also see CBD oil as very common, but the most highly effective is using both pharmacological and non-pharmacological. So CBT is a cognitive behavioral therapy. It informs the patients of their condition and their cognitive strategies on how to cope with the situation rather than stress over it. Because your thoughts do create your feelings, and those feelings are then created to your behavior, and your behaviors are then reinforced with those thoughts. So we need to use this and able to help patients get through and treat their patients. Thank you.